Hello everyone and welcome back to Medigap Show. I'm Holly Cohen, licensed agent and founder of medigapcares.org, where we're dedicated to helping you navigate the intricate world of Medicare. Don't forget, you can always schedule a free consultation with either me or an experienced licensed agent on my team by clicking the link in this video or in the description below. Welcome to today's deep dive into Medicare Advantage. In this episode, we are unraveling enlightening articles that provide unique perspectives on the current state of Medicare and Medicare Advantage. So let's embark on this insightful journey together. Our next destination is a crucial topic highlighted in the article, Majority of Medicare Advantage Enrollees Don't Fully Understand Their Plan, from Fierce Healthcare. Most Medicare Advantage beneficiaries are satisfied with their health plan, but many enrollees feel they are overbilled, have struggled navigating the prior authorization process, or are confused by the features of their plan. A new survey from Retirement Living recently revealed. The survey found that 71% of beneficiaries are satisfied with their Medicare Advantage plan, with most people choosing a Medicare Advantage plan due to the plan's affordable costs and out-of-pocket expenses. Other factors that contributed to the decision included coverage of prescription drugs, access to providers, and the ability to choose a doctor, comprehensive coverage options, and medical and preventative care options. In addition, 61% of people said their Medicare Advantage plan outperforms their previous coverage plan. But of course, they could have been on an under 65 healthcare plan, Affordable Care Act plan, which has very high out-of-pocket. However, only 44% of Medicare Advantage enrollees say they fully understand their plan, with 68% saying certain details have caused confusion. No surprise. Dental coverage was the most reported area of confusion, followed by out-of-pocket costs, which this year on the large PPO Medicare Advantage plan can get as high as $8,300 for the year for the max out-of-pocket for Medicare Advantage. And people that are on those plans that are $0 premiums, they don't realize what the out-of-pocket cost is. So always ask that question when you are considering a Medicare Advantage plan. Let's get back to the article. Dental coverage was the most reported area of confusion, followed by out-of-pocket costs, transportation to medical appointments, caregiver support services, home health services, and vision and hearing coverage. At least 20% of beneficiaries said they didn't understand one or more of these plan elements. That's a problem by the agent that wrote that policy for them. And they're usually call center agents that run as soon as they write that policy. They go home and they don't even think twice about the person who they just helped on the phone that they didn't help. But I have that covered in other videos. Other respondents believed a lack of familiarity with the plan, 56%, caused confusion, while some, 44%, believed there was inadequate communication and education about benefits offered. More than 1 in 4 beneficiaries reported paying out-of-pocket costs for services they believed were covered by their plan, while 1 in 10 said they thought they were overbilled for their Medicare Advantage plan. Some Medicare Advantage enrollees felt unsatisfied by various elements of their plan, including telehealth services, online and mobile app management, and chronic disease management programs, while 20% of respondents said they experienced delays in care caused by the prior authorization process. Of the nearly 1 in 10 enrollees who thought they might switch coverage plans in the next year, 50% cited cost and 39% wanted to switch provider networks. Recent studies have highlighted the positive impacts of Medicare Advantage plans for enrollees, including a report from the Elevance Health Public Policy Institute. By the way, they write Medicare Advantage plans, so I'm going to just give you that reference. They found that 83% of dual eligible, that means Medicare and Medicaid eligible beneficiaries for Medicare, and 75% of non-dual eligible individuals used at least one supplemental benefit a year. That would mean these extra benefits that you hear advertised on television. But again, those are focused for people on Medicare and Medicaid. Analysis concluded that Medicare Advantage enrollees find value in plans when they need to meet personalized needs. Medicare Advantage plans are also more popular with individuals from marginalized backgrounds. I had a comment in a different Medicare Advantage video asking why certain states had a bigger Medicare Advantage population than another state. So I'm going to read from another article which may help to explain that. Medicare Advantage plans are also more popular with individuals from marginalized backgrounds. Analysis from ATI Advisory showed that a higher percentage of Black, Latino, and Asian enrollees choose Medicare Advantage than fee-for-service plans. The report showed that Medicare Advantage beneficiaries also tend to live in more socially vulnerable counties. I'm going to include descriptions pinpointed down to the county so that you can see how these plans are hyper-focused in some areas, marketing to lower income individuals and very vulnerable parts of our senior population in the United States. The report showed that Medicare Advantage beneficiaries also tend to live in more socially vulnerable counties, as I just said. Retirement Living surveyed 351 beneficiaries, asking them about premiums, customer service, and provider networks. The median age of the respondents was 69 years old. Okay, so let's get into this article. Lastly, here on the Gothamist. So, could be changing, but right now, here's what it stands. The New York City retirees. This is the article on Gothamist 2023. Judge permanently blocks Medicare Advantage switch for 250,000 New York City retirees, city to appeal. A New York City Supreme Court judge permanently blocked Mayor Adams' administration on Friday from shifting hundreds of thousands of municipal retirees off their Medicare insurance and on to a privatized version of the plan. But the city immediately vowed to appeal the ruling. Judge Lyle Frank wrote in a decision and order dated Friday that the city is permanently enjoined from requiring any city retirees and their dependents from being removed from their current health insurance plans. The city is also barred from forcing retirees or their dependents to enroll in an Medicare Advantage plan, an insurer's Medicare Advantage plan. The proposed cost-cutting replacement or requiring those parties to find their own health plan per the ruling. The proposal, which originated during the de Blasio administration and has the support of municipal labor unions, could save the city $600 million a year. Retirees had protested the planned transition as a potential obstacle to accessing certain medical providers and treatments that left the door open for increased out-of-pocket costs. Jake Gardner, who represented the plaintiffs in the case, praised the outcome in a statement on Friday. He said, "Because of Justice Frank's well-reasoned decision, hundreds of thousands of senior citizens and disabled first responders from 9/11 will be able, and after, will be able to continue receiving the medical care they desperately need and to which they are entitled," Gardner said. The decision follows a preliminary injunction blocking the transition earlier this summer, just days before it forcibly took effect. After retirees sued over the plan in late May, at the time, Aetna stated that only 1,667 of the 250,000 or so seniors affected had made the decision to voluntarily opt out of the Medicare Advantage plan. Jonah Alon, a spokesperson for Adams, said the mayor's office was extremely disappointed in the ruling and planned to appeal. This Medicare Advantage plan, which was negotiated closely with and supported by the Municipal Labor Committee, would improve upon retirees' current plans, including offering a lower deductible, a cap on out-of-pocket expenses, and new benefits like transportation, fitness programs, and wellness incentives, Alon said in a statement on Friday. But Marianne Pizzatola, president of the New York City Organization of Public Service Retirees, one of the lead plaintiffs in the case, said courts have had to repeatedly step in and stop the city from violating retirees' health care rights. New York City retirees have earned their right to federal Medicare, and we relied on the promise we would have this benefit through our lifetime, Pizzatola said in a statement, and I agree with her. We hope this decision will help retirees nationwide stop their former unions and employer from privatizing the federal public. Wow. We hope this decision will help retirees nationwide stop their former unions and employers from privatizing the federal public health benefit of Medicare so we can live the rest of our lives in peace. So well said. The impact, a court ruling for retirees in New York City. In a significant ruling, a judge has effectively stopped the proposed transition of New York City retirees, 250,000 people, from going on to Medicare Advantage plan. This ruling cites concerns that could change or limit retirees' access to their healthcare services. This case serves as a poignant reminder of the intricate balance between implementing changes and safeguarding healthcare access for Medicare beneficiaries. As we now reflect on each of these articles, we can understand more how Medicare Advantage has changed since it began in the 1970s. That was the beginning of the privatization of Medicare. In the late 80s and early 90s, Medicare Advantage plans became born, and they were part of the Balanced Budget Act. From that time until now, in 2023, Medicare Advantage plans have gone very high with the max out-of-pockets. They have overwhelmed our news channels with all those commercials that are about Medicare Advantage, not about original Medicare. Stay tuned for more informative information and changes within our Medicare and our Medicare Advantage programs as we help you navigate the ever-changing landscape of Medicare. Remember to give this video a thumbs up, share it with those who you might think would benefit and engage with this information. Feel free to comment below any questions. We are happy to answer them. Thank you for joining me today on this exploration of Medicare Advantage. Stay tuned for more updates about Medicare. Stay informed, and remember, knowledge empowers you to make the best choices for your Medicare journey. Until next time, take care, goodbye for now, and as always, be well.